a case study. And case study today, we're gonna two case study today. One case study, the person get to the gym, start working out, and tell me more.
Well, I work out regularly with a band class and everything.
Don't tell people that, because they're not gonna go to my band class.
No, but it's because I have injury.
I'm just kidding. So yes, sometimes people not doing right. The posture is poor, or some movements is poor, and they might injure themselves. So David, he's done the class with me, and he wake up. Later he's gonna feel that pain. Tell me more.
Okay, so I did a massage treatment, and I did a movement that I don't normally do.
Okay.
I put a lot of weight on this hip. This hip has an injury, and because of this injured hip, that it caused in the morning 2 nights ago, my legs were aching all night. Like there was something wrong with my disc, maybe. I didn't know what it was.
It could be a little bit inflammation. So he pushed that the femoral bone push inside, create this pleasant movements, or it's been all muscle around surrounding tissue, maybe even little tear, like what's that, acetabular being tear, and sometimes it's radiate, or sometimes it's uneven hips, and that tensor fascia lata muscle right here, it's look like a it's feel like a pain. Could be SI joint. So what we're doing today, we're gonna figure this out. So tell me, which movement was very painful for you?
It's very hard to do. This is very weak.
So
very weak. Hip flexion is very difficult. I can only go to here now. I have to force it up.
So it's limited.
And it hurts in here when I do that.
It's on the side,
but it fixes the pain. If I do this and force it, then I can sleep. Like last night, I was fine. But I have to keep doing this stretching, and it's very, very weak to do.
And just describe, is it just right in this area?
Yeah, it's right here. It's right in the gluteus where I was injured, and something is not healed. It's been years now.
Ooh.
Years. It's been 6-7 years.
6-7 years with the injury.
Still having problems with it.
Unbelievable. Let's see if we can fix in 10 minutes. I'm just kidding. All right, so what we're going to do, go ahead and stand up. Let me just get that. Help me out to put the table a little bit in the back so we can just show more. Go ahead, stand up right here in front of me. So what we're doing, I can see this ankle is a little bit collapsing. So the ankle is doing this. Yeah, it's not that bad, but it's there. So what we're doing now, we want to measure that hip. And I'm watch this hip. He's actually, which is, look, turn around to the camera. It's right in here. You can see the left one is higher. So
this one's higher?
No, this one is higher.
Right,
so
higher.
Exactly. So this ilium, it could be like rotate this way, or that one is pulling that way. It's you have to figure this out.
Higher. Okay.
So that could be the possibility that's tensor fascia lata is get a little bit kind of knotty, and you feel that all the time. We're gonna check those range of motion and of course the strength. So go ahead, lay down. Let's do Thomas test. So what we're doing with Thomas test, he sit down tiny bit on the edge of the table. Just a little bit, and a client, usually roll back. I help him out. I hold it all the time, so give him support. He bring those 2 knees together, and now I'm looking those legs if he can pass 20 degrees. He did pass. It's fine. So now go ahead, drop that non-painful first. And you see, wow, look at that. Is that the pants, or is that your?
No, it's me.
Yeah, it's not the pants. If you see this from the side, look at that. It's in the air. So the quads, the hip flexors, everything is like a tense up. And relationship, look at this. It's coming to the left. So internal rotation also could be there compromised. Let's return back and doing this one. Look at that. So what we have here, the quads is definitely need to be released. That hip also could be the problem. Go ahead and turn on the table. Yes, just lay down. Yeah, help me out if you want. Sorry, we don't have that wide lane, so we have to move. So we're gonna see our heads. So lay down, face up.
Face up. Okay.
Yeah, face up. So
This is a big problem.
yeah, we going to hunting him. Yes, I'm a hunting you down. All right, let me get this camera because we got this AG Pocket 3 now, which is so cool. And we don't have a Daniel right now, not yet. He's gonna come up soon. Let me just see if we can pull this out. Hold it right in here. Perfecto. So what I'm doing here, I measure that ilium when he's laid down. Why I'm doing this when he's standing and now he's laid down. I want to see if it's changed because the way we're standing, leaning from one side to another, shift those hips, shift its whole spine. No gravity right now. We're going to do those tests. And I found those anterior sacroiliac bone and boom. This is almost even. It's perfectly even. So the way he's standing and leaning on that left leg, so right hip is kind of pull it out. So he could be leaning this way. You know, sometimes you lean on that side and that's raise up. But the way he's standing, he's probably kind of a little bit back, so this hip is getting up. It's always need to be tested. You can't just do massage without assessment, without those range of motion, because you don't know what you're doing. We know what's the cause of the problem. Could be the weak glutes and all that stuff. Also, we have that scar, as we remember, abdominal area scar on the left side.
It was the scars here.
In the middle. Yeah, all in the middle.
The surgery was here.
Yeah, so this is also pay attention to the scars, appendicite removed. This always get that area tight, you know. Yeah, I know, but I'm just saying appendicite for people.
Right,
people get the appendicite removed. It's very common surgery, and get the scar tissue on that hip flexors right in here, and always that hip, because after surgery, no one do any rehab, and that can be the problem.
And hernia surgeries, when people get hernia surgeries, there's scar there too.
Yeah, it's exactly. So let's raise this leg up. I want to see that hip flexors. So keep raising up. Oh, that's it. So, okay, so this is it. And this is, let's see if I can help him. And you see, look, I can go to this 70. Yeah. So, but look, one more time. Do you? This is probably like 50, 45, and I can get him to 80. So what's happening? It's not the mobility problem, it's the motor control problem. The brain, for some reason, don't want to finish that movements. No. Is any lower back pain?
No.
All the time. If you do this test, if lower back present, they might have a disc involved. So always ask the pain, if pain present. Let's raise this one up. This one is a little bit better. And here, I feel a little bit of restriction. So when I push this way, I feel the restriction. Could be a hamstring, it's like a soft tissue problem, but most of the time it's so what I'm doing first, I'm check those internal external rotation. I'm gonna do this on that one. So it's 35. Nope, it's no 35. It's no 45. So we done here. Faber test. Ooh, look at that space. It's like that's fine. You can also test the ankle. Let me show you on this one.
Like this?
Yes, it's like whoo. All right, so here we go. Ankle 20 degrees, 0, 6, 7. So ankle is not working. So we focus on the ankle too. Next one, we're gonna test this one. We're gonna bring this up. I'm not sure if you don't see in this camera. Okay. There we go. We can see on my phone right there. Okay. And look at that. This is like nothing. Nothing. This is 25. So we don't have this external internal rotation. So that femoral bone is stuck in that socket and it's not moving. It could be the soft tissue. It could be mobility problem. Set up, sound, everything. So my first one, I'm going to show you on that hip. This is my favorite one. I bring this to 90 degrees. You see the table is low. I don't know why people always that pull the table so high, and they always shrug that shoulder and get that problem with the brachial plexus nerve later. So the leg is 90 degrees. All I do, get that arm under that knee, cover on the top, and I lean on the top. That's it. And I'm stay up here and hold it. So I put that bone in the socket. If any pain, client, let me know. Does that feel okay?
Yeah, it feels good.
It feels good. Every time, every move, ask the person. And like, let's say I'm gonna stay 60 seconds here, 1 minute to 2 minutes, whatever your time. If he's come in only focus on that area, I'm probably spend all hour. And let's see if we can increase that hip.
It's always been.
And I start doing rotation. So what I'm doing, I stick in and rotate slightly. I do not moving that. I don't want to put too much pressure on the knee. So knee, I'm moving only that femoral bone. The knee, just follow it. Okay. So, and I'm doing this for about 2-3 minutes. This again, push, hold. You see, I'm leaning with my weight. If you're a woman, you put some pillow between your breast and the knee, or double sheet. If you want an extra tip, don't put anything.
So you go this direction, or you
Yeah,
go,
and I can. This direction it's not bad.
You could do, but this way, it doesn't
Yeah,
matter.
it doesn't matter exactly, but
That's
the way,
easier.
the way is easier for me. Next one, I want to distract a little bit. So I get that knee coming inside. You see under. Now I'm lock it in. The other arm come on the knee, another one lock it in. So it's a lock. Now I'm just pull myself back. I pull. You see, I can pull them up. And it's even if this is big person and you tiny like a girl, you can always just lean back and it's feel great. So what we're doing, we just distract that. See if we can help. So I'm just pull and come back again to this hip grab. You see, right in here. Lean back, start turning more. So I'm gonna show you this side, and after we jump to the right one, because the right one is painful. But for the video purpose, I wanna show you how fast we can release that, mobilize that hip. Okay, if any surgery, like a hip replacement, very gently, I will probably not doing a lot of like this rotation. And look at this. This is internal rotation of the hip. I will probably not do a lot of internal rotation of the hip for hip replacement. It depends on the hip replacement. Some people have that sports style. You can move all around. Just mobilize that soft tissue around that hip. Some new surgeries, they get all those crazy technology, and those hips is just amazing. And look at that again, and down. And usually I tell the clients to come every other day, like maybe 2 days break, 48 hours, and come back and work on that hip, and give them, of course, homework. Remember? And now look at that. It's 35 degrees.
Wow.
That was like 20, 15, exactly. Never been. And of course, this is much better here. What I'm doing, I bring to this position, ask him to push against me. So this foot is come close to me, my way. Laterally, outside, you just hold and relax. Let's add our favorite neurotraining. Let's say if he start moving that tongue around the lips, go ahead, move around. So all he's doing this. let's see, this is the limiting. So he's doing that tongue and eyes later. We just see which one is work better for you. So I'm holding, I'm not doing anything. A couple more and relax. See if I can bring more. I did bring more. 3-4 degrees. This is proof, right? Okay, hold it here. I'm not moving. Do your eyes left and right. All he's doing, move his eyes in all different. Don't move your head. Left and right. She's moving his eyes only. Up and down. And as far as we're doing towards to the right side, I want you to finish with your right. So look to the right and hold. So he's looking to the right and hold. Did I add a little bit more? A little bit. And look at this. And this has been big improvements. Okay. Now ankle. Yeah, ankle. This is I believe we have a full video of ankle work, but we definitely, you see, it's no plantar flexion, so we want to work on that. We're going to work on that talus area where does it connect to the stuck up here. You see, we don't have that plantar flexion, and it's stuck always in here. That joints right here, calcaneus and your talus, it's not. You see, it's not going there. So we watch our ankle video, so we can.
I want to get exercise to help build.
Yeah, we can show exercise. We actually post couple exercise. What we can do here, let me grab that video. Okay, all right, let's do it. Why not? Why not? We just do it. And ankle is mess, he said. Yes, he's a mess. God damn it. Okay, yeah, usually I put 2 fingers like that, Tom, and I start mobilize it. I pull towards that camera is it good? Yeah, I can see on my phone. It's perfect. You see, that's what this beauty of this. You can see what you're recording. And this big camera is I'm watching on my computer. So what I'm doing here, I put, and usually clients just slide forward, but that's okay. So I'm doing this. Let's see if we can improve that. Here we go. Do you feel that click?
Yeah.
It's already been pop. Do I do force? No. I'm a gentle. I see all those new kind of massage style. I'm so surprising. Massage therapists do all those forcing adjustment. I watched this guy training, and he's a massage therapist, and he trained that kind of style. You know, I don't think you're capable to do this in America, so you don't get yourself in trouble, and you don't need to use force. Mobilize that foot, you see, working around, and do separate each toes, work around. This is a lot of action right here. I can feel it stuck, it's not moving. That's probably the cuboids and cuneiform is stuck together. They usually do. Next one, I love to do this because our foot, when you step on your outside foot, and after you drop that down, for most people, they flat feet, they just go step the whole leg. Here, he still have an arch. I'm doing this manipulation. My arm is covered the top, and other arm is that toes, and all I do start rotating in all different in this direction. You see, I'm kind of trying to squeezing, like you squeeze that wet t-shirt or towel. You're doing this, yes, in all different. This is the squeezing.
That helps with the arm.
Yeah, you can stick in. Here we go. You feel that clicking? This is a lot. So this is the motion. I rotate it. In, out, do some pumping. I love to do this. I hold that heel, that calcaneus bone. You see, I'm not pushing on the knee. People, I see a lot of doing this. This is dangerous. I put this on the quads, and I'm lean. Ask him to resist, push. You can also use your chest. You can pull on your chest and doing this. Both arms holding that. Pull on the chest and let it go. You see? Every time, breathe. Yeah, very gently. You feel that first barrier, you hold. And remember, this one was problematic He can't raise it on his own. Let's see if we can help him out.
Good leg. This is my
I
good
know,
ankle.
I know. We're gonna work on your bad too. So I just want to see.
I'm just saying.
Look at this. This is start moving. This ankle. I don't know. Is that moving?
Yeah.
Is that moving or not? It's better. Yeah. I'm not.
Do that.
Look, I'm not Jesus Christ. I don't have a hollow above me. I can't fix. Hello, I can't fix you in one session. It's a long-term relationship between massage therapist and client to help him out. If people still get this in my mind, or if I have a pain, I go to massage therapist, he just touch me and I'm gonna fly. No, and that's a lot of clients. You need to explain that, and a lot of therapists. Oh, no problem. Let go. I'm gonna fix it. I'm gonna fix you, and nothing happened. The people still experience pain, and people never come back to you. So you have to create that long relationship and tell them how many at least session to feel big difference. So you see, and it's come back. It's go back to this stiffness again. So what we did, we just work. Now it's getting back. Yeah, it's not get to this level again. So something going on, his brain protecting him to do all those actions. And that's happened a lot. So I do it again, and I do rotation.
So this is what you do for the motor when it's a motor problem.
Motor control, no. I'm going to do bands. Like this is what exactly you did. We don't know how you did that, but you injure. And look at this. It's getting, again, get to this. It's better again, 35. You see, we did, and it's come back to this low limitation again. Why? I don't know. Working on the quads, of course. Usually, like I said, I'm on Draper people and working on that attachment, working on those hip flexors. Remember, he got that surgery. Maybe I placed that on the belly. Let me see the camera so we can apply right in here. Perfect. So I am, if any surgery was, I'm very light and I'm not gonna push too hard. I'm just let him breathe and apply light pressure. That's it. Very gently. I'm not pushing hard, no angle. This is how we release that hip flexors. And he got maybe a lot of scar tissue up there.
I feel like scar tissue.
Yeah, I feel like a spongy. You can touch. You can feel the big difference. Always feel. And if you don't, ask your clients, what do you feel? A lot of massage therapists, I see the clients that get that faces that's, crunchy, like the eyes is pumping up, and massage therapists still do his job. And when people start screaming, he's asking questions. Are you okay? No, he's not okay. He's already screaming. So very gently. We don't want that brain get that fear and scary, because if it's pain, your brain is going to shut it down. Everything is not going to release, because that's the problem. People think if it's through the pain is going to release that. No, it's not. Very gently. Your brain have to trust what you're doing, and that's why they're blocking. They don't want to feel your pain. Why his hip is not working? Because it's maybe was pain long time ago, and the brain don't want that pain again, so they limit it. You can raise this leg. That's the issue. And you see, I work just a tiny bit. I'm not pushing any pressure, massaging like a baby massage here. We don't want any aggressive technique in here. Working around, and like I said, this is because the surgery was there. Usually I go a little bit deeper and work a little bit deeper. Now it's time to work on that, the bad one. I know it's not going to be good for the camera purpose, but let's see what we can do. Okay, so I come up here again. This is the easy way. Oh, I got the money right there. No, leave it. It's my tip. So again, if I'm standing my right side, my right arm is coming in. You see? It's grab that knee right in there. I grab it. I hold it. Now I come in and I lean on it. You see, I'm leaning that socket and pull inside. Hold it up here. Maybe talk to my clients, ask them questions more, because this is the time, because you're not doing anything. You just lean. And he started rotate. Feel relief. That's what we're looking for. The client looking for relief. I think I need to get that camera up here, you see? No, we're the camera people, we're the massage therapist, everything. That's how it is. Okay, again, arm up here, support. You see this leg is on my arm, and I'm lean. And start mobilize it. Tiny bit, tiny bit. Tiny bit. Again, return, push, hold, and it could be like 10-15 minutes. Don't give up. I have one guy, he came in, I worked 20 minutes to get this 5 degrees, to change to 5 degrees, and at the internal rotation of the hip. And it was happened. Or we should check extension of the hip too, on the face down, when person face down. We can do that. Usually it's very poor. Yeah, extension for older people, it's really hard to do this hip when you raise this leg and it's extension of the hip. It's very poor. It's supposed to be from 10 to 15 degrees. It's a normal. And some people can't even lift it up, but that's okay. So what we're doing here now, we decompress. The arm is coming inside. Again, this arm on the quads, lock it in, block, boom. Start pulling. You see, I'm pulling back. I'm just leaning. Do I work hard? No. Feels great.
Yeah, I feel that.
Yeah. Sometimes there's a pubis symphysis problem. We can do that too. Yeah, you feel that pulling?
Yeah,
good.
Though. It's good.
Yeah. We can do side position too. I will show you side position. Like I said, this is the whole case here. Pull. Again, I come back to this move.
So you do this until you get like 5 degrees or so.
If I get 5 degrees today, I'm going to be happy, and my client is going to be happy. Here we go. Let's take a look. I'm not sure if you guys are going to see it. Look at that. We definitely help with this external rotation of the hip and add around, I would say, 5-10 degrees of the internal rotation. Now, of course, we're going to do the bands. Remember, his glutes might be not fire up. I'm going to place that ball and ask him to push that ball down and try to kind of push his butt up. Exactly. Activate all this. I'm tapping. I got the money. Eagle. Perfect. Keep pushing. You see? And let it go. I want you, yeah, exactly. Do this. Like push for 3-4 seconds and let it go. He's fire up those glutes. And I want to feel those glutes. Fire up. Yeah, the glutes is a little bit weaker. Yeah, and I see sometimes on the class when we do glutes, he's kind of like, he's go to the right pretty good, but the left, he's kind of like try to, a little bit wimping. Because body, like I said, very smart. And let it go. Keep pushing. Let it go. Perfect. This is what the PhysioMassage is, because with all this tool, that should work. Reactivate. Okay? Perfect. What else we have problem? We have yeah, Let's raise you. Let's raise your legs both up. First of all, I'm gonna do pubis symphysis. The legs is coming like this in 45 degrees. This is 45. He spread this leg. I usually go do on that side, but for the camera purpose, I do this way. You place your arm between his leg. You see? Now he's gonna squeeze, try to break. And it's also tell me his adduction is very weak, especially on that left one. Try to do one more time, squeezing, and I start rotating him. Keep squeezing. You see, I'm doing this. Keep squeezing it. Yeah. Now I ask him to turn head. I'm going up here. He turn his head opposite way. When I'm turned back, keep squeezing. You see, he's not multitasking. So when he turn his head, he losing this control up here. So something going on. He get that. Great. Perfect. Let it go. Okay? You doing okay? Always ask your client how you feel. Next exercise, we want to work on those gluteus medius because they always kind of be weak. Get that ball between your legs. Get this in your air. Squeeze that ball, and I want you to start spread these legs. Just like that. So squeeze the ball. I'm gonna help him out. Just like that. And which one is this one is limited. So I take another band, I come up here. No, hold it up. And I come up here. So he's moving this leg in and out. Move.
What's the spasm here?
It's max spasm. Here we go. So we find out the gluteus medius is in spasm now. Why? Because they're weak.
Oh, it is. I don't know if it's TFL.
It's a TFL too. Yeah. Oh, okay. It's TFL. You see?
Oh, spasm.
I know. I got those TFL a lot. Spasm.
Yeah. It can't go anymore without
Okay,
spasm.
what I'm doing for the camera, I'm gonna hold. Is that spasm?
Yeah, it's
Okay, try to move. Try to move that foot. Is that spasm now? I'm holding. I'm do this. I hold that muscle. You see how weak we are? Yeah. It's another one. Let it go. So in this position, it might be too much for him. This is called wiper shields. I place that band on that ankle. Try to spread them and doing this in and out. And that could be the spasm too, because this
No, I can do it.
you can do it. He can do it.
When it's the knees bent.
Just do it. Put your back into exactly. So the knee is bent. What's that mean? So though this IT band, the tensor fasciae latae problematic. So yes, he's doing that.
It feels good.
He feels good. Let's he's activate a little bit. Let's return to this muscle again. So bring it up, hold it. Go ahead, squeeze that ball, and see if it's gonna create that spasm again. Go ahead, pull in and out. I can help him out. You see, we work it out. I always help. This is what the band is for. So he got that spasm. Yeah? Work. Is it working? It's working now. It's no spasm. It's no spasm. Now try to be on your own. Yeah, look at that. He's moving. How cool is that, right? Yeah. And look at that. Like I said, always have those bands, ball, and the long band, which is you always help your client. So rotate in and out. And tired time, yeah. This is probably going to be the size. You see the difference between white. Okay, I mean it's wider. Now here we go. And it's now it's even better for me because I can sit down and you can go around your arm like right here, grab it. Okay, sit on the band and create tension. Here we go. And you can control the tension. You see, all you need to do just butt in and butt out. Go ahead, keep doing that.
So straighten and bend.
Yeah, that's all you need to do. And I can help him go a little bit up here. It's hard, so I help him out. Yeah, because we want to teach that.
Keep the knee bent.
Yeah.
This is a tough one.
This is a tough one because he activated everything. I don't know if you guys see on that camera. There we go. There we go. He's breathing. Ooh. There we go. And let it go. Okay. So next one. Yeah, so tired. Next one, remember he was trying to raise this leg up and it wasn't spark it up. All we do, hold this band up here and with my arm ask him to raise this leg up and down. Raise up, hold. And let it go. I help him out all the time. This is where that truly massage therapy is. It's a physio and massage together. What can be the best, huh?
He doesn't have that much power. Like I couldn't do it on my own.
You can do on your own, trust me.
No, that band is
too much, yeah, because I took the heavy band. You can, like I said, have that set as $8. And next one, I'm going from the top. Why not? I want him to push down. Exactly. What he's doing now is hip flexors is working now. All different variation. Side, why not? I don't want to hold. I can hold with my arm. I can step inside and attach to my knee, whatever you have time. So try to go to the side and into the midline. Bring it in. Which one is working now? Those adductors, correct. So he's activated his adductors. He's weak on adductors. And if you show him this exercise at home, he can capable to do that. He can attach to the door and do this everywhere he wants. Especially people for travel, the truck drivers, all kind of drivers. Again, up, pull down and up. Switch, get that ball again, push that ball, raise this, you see, he's raising that hip, activate the glutes. Yeah, push. If he's not doing that, you can slap the client like this, like stretching with the band, or slap him, no problem. Tell him it's a part of the treatment. I'm just kidding, don't do it. And let it go. Okay, let it go. So let's see if we can increase that angle. So it's you just witness. Go ahead.
Yeah. It's stronger.
It's stronger? You feel stronger?
Yeah, it's gonna
and it's better. It's spasm.
Spasm there.
It's spasm there, of course. So we work on that quads, and usually, yeah, and
I haven't gotten it.
He not gave it that high. Now it's high. So what I'm doing, I usually find that biceps femoris, I just palpate it and I find that spot, sensitive spot right in here. Do I want to push? No, I'm just going to hold it, and I usually find 2 fingers, 3 fingers, whatever, that spot, and I cover with my palm, just like that, and I hold it. And I just moving around. That's all how I work on the quads. I do not stretch quads.
Yeah, that's where it was.
Right there.
Yeah.
Yeah, I feel it. It's very sensitive. That people call that trigger points, trigger point therapy.
Is that a scar?
It's
Is it a terrier thing?
Yeah, that's what this where's that muscle come together. It could be. It's a lot of could be adhesions, working around. I also asked the client. Remember, we get that Thomas test. Sensitive, exactly, sore. So when it's sore, I'm just holding it. If you want more, I ask my client slide a little bit to the side. On the side, and all I do just drop that band. You see, drop that heel. I can do up here. I just come up, and I push. See. I mean, if you want to work this way, you can work with your arm. You can do this. See? The table is low. If table is going to be high, you're not capable to do that. But I'm available right in here. I get that and I work. But I don't want to work hard. I work with my legs here or here. I push it. Here we go. And it's in stretch now, right? So it's the area pops up more. I ask him to push against me. Yeah. more, I can attach the band to this ankle, apply to my table, and he start doing this exercise. Or whatever, you guys, just whatever your imagination is take you. Here we go, right here. I'm gonna step on it. It's on the way? No. Push up. Push this band like this. Yeah, strengthening. Look, now everything is working. You feel that?
Yeah.
You look at this. My fingers can't stay on it because he start rolling. Yeah, look at that. He's working on that quads.
Yeah.
Uh-huh. Here we go. And we have another person. We're going to work on that shoulder today too.
Yeah, it's tough.
Tough. Look at his face. Is that pain?
No, it's
just hard. Yeah, his body
Fatigue.
works so
It's
fatigue, but no pain. As far as no pain, you're good.
I can't even go. It's like
Yeah.
more juice.
That word, I can use this band. Say it again. That's it. Now you can. He can now. I'm just joking. You just play around, guys. So work on that.
Oh my God.
Exactly. Now release. Let me go. Go back in the midline. So try to do it now.
Yeah.
Look at that. He was like, I mean, he tried to cheat. I can see he pushed this leg. Let's say, okay, let's do this. Do it again. This one is pushing down. Look at that. Try to make a little bit straighter. Look at that. So the problem was his motor control problem. It wasn't mobility problem. I mean, mobility, external, internal rotation, but that flexion of the hip wasn't problem. That was motor control problem. Okay, we go back to this knee again. It's still good. Remember, we did this one and it's gone in 2 minutes. We come back again, work again. Arm, holding this under the knee. Lean on it. If you're a woman, like I said, put the pillow, sheets, and you start rotate it. You see, like this. Rotate it. We're not moving knee. We just move that bone inside that socket. I push in, rotate. Push in, rotate. Very gently. If people describe pain, send them to the X-ray or MRI. He might get that acetabular joint tear, which is coming, very coming. And you going this way. Another test. This leg is come towards the midline. The other one. You step behind that knee and you hold this way. Push against me. If pain, send him to the doctor. Let it go. Also great exercise too. Remember, we got that tensor fasciae lata, gluteus medius.
Right.
You can use the band again. That's why I love those bands. In and out. Here we go. Yeah. I can stabilize so he's not gonna do it. Do not put the bands towards your face. Away. If the bands is gonna snap, it's gonna go to your body, but not to your face. This way. Yeah. You're gonna ask me what kind of massage is that? That's what the physical massage is.
So now, if I
Away.
stretch it,
Away. Towards the midline.
I can't.
He can? Okay, help him out. Drop it down. Right here. Drop it. You see? Now he can. Now he can.
How far should it go this way?
Just a little tiny bit. You don't need to. You just need that first couple inches, and you get more and more and more every day. People try to go all the way up, all the way down. No, it's not working. Don't push yourself. It's take time. Here we go. Okay. I released that. Let's see how we do and how we feel now. If people hairy legs, trust me, this band you have to be really gently. So because if you start rolling the hair, oof, it's uncomfortable. All right, so here we go. Do I improve? Do I improve? Yes, I did improve.
Wow.
Try to raise up again. Look at that. That's definitely better. So we already have a benefits of this class of his treatment. Flip on your side. We're gonna work on that glute medius. Yeah, we're gonna work on that tensor fascia latte. Let's go ahead and stay here in this position. Usually people give pillows and make them. Yeah, you can. I got a pillow for you. Come on, you're the VIP client. Yeah.
If I do too much of anything, it'll just spasm.
Spasm. Bowl. Get the bowl. Start squeezing.
Okay.
Squeeze, relax. Squeeze, relax. Squeeze, relax. You can sit down right there. You can find. You can use your forearm, kind of massaging this area. Doing okay?
Yeah.
So I do feel that. And don't try to push hard. If you push hard, it's going to be pain for the clients. It's a very sensitive area. All I do is just moving around. I want to move that area because I grab that fascia and I pull. Here we go, a little click. If you can use Tom's, here we go. Just work around. Right. How does that feel?
Feels good.
Feels good.
This spot right here.
Exactly. This is, what is it? This is attachment of this.
Attachment.
Yeah, this is where it is. The gluteus medius is a little bit right in here. The piriformis.
That is killer.
Is a killer. Okay.
That's where it spasms.
This is where's the spasm. So raise up and down. That's it. That's all I do. Okay, I ease it up.
It's good. It's good.
He's good. You like it. That's what that's all about. Yeah, and I feel that. It's like, oof.
It spasms, right?
Yeah. You want some more? I don't think he's going to be capable to do this band, but what you can do, you bring this one up here. Let me get this inside. Just one leg. Again, put this bikini line. Start moving up and down. Up and down. Do you feel that?
It doesn't feel so bad.
Yeah. Quads, of course. We activate his quads. If you want to stretch the quads, I will show you the way to stretch it, to work on it. So this is what you do. And he can separate. You can give him this exercise, let it go. The band's going to be both leg inside. Lift his legs up. And you go all the way up towards the knee. Start stretch that band up. So he do clamps and down. And I work on that muscle. You see, he's working and I help him out. I'm helping out. Yeah. Whoo, he said. Good. I'm moving. I grab that ilium and I move that ilium. You don't see on this camera because my butt is on the camera, but probably this one and see it. So I move it.
Yeah, it makes it so tired.
Exactly.
It's good. It's good.
Okay, of course. Release that band. And what else we can do here? Okay, I forgot to show you this one. Okay, so the lower leg, the client have to grab it and hold it so he pull. If you're not going to do it, you're going to move and he's going to move with that knee. So this is...
Do you want me to move down slightly?
No, that's fine. Okay. So make sure he stay, that foot is on your hip. You see, I'm not doing anything. All I can do just grab that knee, get that support on that ilium, and I'm start doing step forward a little bit. And this is what I do. That's it. I bring to this first barrier, ask him to push me, kick me like a ball. Exactly. So he start activated. And 1, 2, 3, 4, 5, relax. And I give him a little bit more. And I give him a little bit more. What I'm doing here, extension of the hip, right? Always, here we go. Do you feel that? That was a big pop. Here we go. Another one, couple more. Stay here, breathe. Again, push against me. Kick. Let it go. Do we need hour and a half massage here? No. 45 minutes, 60 minutes. Because he's working hard too. Of course it's good. Look at that. We start moving around.
Yeah, because that's the motion that I can't do when I walk.
Yeah.
It doesn't go back.
Kick
like
again.
this.
Kick again. Let it go.
If I could get this to go all the way back. So where you're holding on, this is what restricts it.
Yeah.
When I go back. Yeah.
You want more, you can let it go, stretch. You see he's hanging up here. You can also pull that hip. You can grab that hip. You can pull. You can do this kind of stuff. All different variation, whatever your imagination and your tool you have in your library. So, okay, I'll bring it back. Face down. The last thing what we want to do here, it's working on that. Face down. Lay down. So remember, we can also do some assessment here. So pointing out those foot inside, see the position of the sacrum. Yeah, he got some little bit rotation, but that's fine. So we continue work. Also, I see if any bulky muscle. Yeah, a little bit up here, but it's not. I can a little bit relax him, roll from side to side, see where's the most tension. And it's tension on the right side. So that's, you see, he's feel it too. So that's mean he used that right side. Okay, next one, I want to put that ball under and push it down. What he's doing now, he's activate that kinetic line. Push it. You can put the band, ball, whatever. And you see he's relax, let it go. Again, I want you to turn these glutes now. Let it go. And push, let it go. So this glute is not fire up. Let's see if this fire up. Push. Yeah, this one is much better. So this glute is not fire up. And as you guys know how to fire up the glutes, 2 knuckles. This is the horse riders. You apply that 2 fists right on that gluteus muscle, and you do not push on the sacrum. So you get this 2 fists and you start spinning, doing this. But you do not move your knuckles and beat. You're not doing this. You apply and just do that muscle spindle, working around. Again, what's next? Push this on the knee, push down, push down, push down. There we go. Now look at this. The glutes start working. Relax. You feel that? Yeah. Now look at that. My fist is coming up. Ooh, look at that. And relax. Yo, wow. Next one, what I can do here, I can do also internal, external rotation. External, internal rotation. If pain comes up right here, SI joint problem. Every time. It feels good. I'm doing something wrong. I usually torturing people here. Yes. No, I'm just joking. If you feel pain during massage, that means something going on, or therapist doing something. Have to be easy. Okay, holding here. In and out. In and out. That's fine. Because I wasn't ready. Try to show it to him. Here we go. What he's doing here? Yay. 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 He's working on all those muscles. If I want to do here, I come up from the other side and do it this way, right? Let's do that. Why not? Again, hold on. I usually put my wrist like this. So go ahead.
That's the small band.
It's what?
That's the small band, right?
Yeah, it's a small band. You can do long, you can do short, long, whatever. Like I said, you guys play with your imagination.
Very rigid.
Exactly. So this is that the gluteus medius.
Internal rotation.
Exactly. He already know. He's gonna sleep like a baby today. Here we go. Perfect. Again, release. He's tired. That's fine. Release that leg. Again, come back. Do this muscle spinning. Remember, we don't have a lot of. We did Faber test. And what we're doing, it's a position 4. My favorite position 4. Grab that knee. Make sure it's no replacement in the knee, and always talk to the clients. I let the client know if you experience any pain right now, you tell me, okay? I'm going slow. So I lift that knee up, grab it, that knee, pull towards me, and drop that foot down. Look at that hips how it comes up. Look at that. You don't see that. Let me show you on another one. So grab, pull it away. Look at that space on him. So what's that mean? That space. We got that hip flexors so tight. Usually I do bands, I do all type, or I do butt CPR. My favorite butt CPR. I come up here, lock that foot up so it's not coming up. Come in with my both arm like this, crossing. It's called a butt CPR. I'm apply that right on that ilium and ask him to breathe now. Inhale, exhale, and when he's exhale, I'm apply a little pressure, just a little bit, and it's a butt CPR. You're doing this till you feel it's not going anymore. So when you push it down, it's like completely stuck. You stop doing that. And release. And now when I did this for around minutes, I started doing pumping. We try to save that butt. Come on. We lose him. Come on. Yeah, it feels so tight. If you feel stretch in the hip flexor, where do you feel stretch? Yeah, okay, perfect. So you're just doing this butt CPR. Try to, like I said, save this butt. Only this pumping, okay? That's it. See, this is increase? Perfect. Yes, it is. Okay, who's gonna, Daniel, you wanna do this one on the other side? Perfect. So, release that. Again. Exactly. Daniel is gonna do the other side. I'm gonna do on the phone. I'm gonna do on this camera. Yana, you gonna do this or you done this before? Okay. So yeah, you kind of like don't put like on the side, like yeah, not like just a hold, so it's not gonna. Yeah, you don't push on the bone. Get that sacrum and start direct pressure down. So you lean with the body. You see Daniel, he's lean with the body. Ask him to take a deep breath. And when he's exhale, you push a little bit more down. And always see the space now and after. Good, he's breathing. And sometimes you feel a little click, pop. It's a SI joint being locked back. A lot of people walking with those open SI joint create that pain, that grinding sensation. And now you can apply a little bit pressure, like, hold on, I'll show it to you. So, no, just like he's breathing, breathe, and you exhale, and you start doing this. That's it. And exhale, relax, let him breathe, and exhale, and do it again. See that space is get shorter and shorter. Okay. Good. Again. And yeah, you can do a little more. And let it go, yeah. Oh my God. Always communicate with the clients. Yana, if you want to do it, you do it.
So I mean, in perfect world,
you have to be like 1 inch.
Can I move your leg back, David, for a second? So in perfect world, what should be the height here?
1 inch. Between this is bone right here.
Like that?
Yeah, like that. Yeah, and you can.
Twice less than it's now, right?
Yeah, it's been less, but you need to keep working on that one. Okay, Yana is coming and gonna work. So, do you feel this in your lower back?
Yeah.
Yeah. So, Exactly. So when he's feel that's mean yes, that's the problem in this hip flexors every time. But look, your lower back is more relaxed now. Yes, for some reason it's oh wow, it's coming to this side now. Yeah, so you work on that lower back too a little bit, just get him this.
I felt it on the right side.
Yeah.
You're saying the left is tight.
Take a deep breath. So what I'm doing here, it's a little twister. I'm mobilized that thoracic area. I'm not do powerful exercise like a chiropractor. All I do, I just twist that a little bit. I do not push on the spine. Okay, Yana, here we go. So you do this, it's called position 4. Now she's gonna do that side. So bring it up. Perfect. Excellent. Lock it in. And start holding it and just push. Apply the pressure. 2-3 pounds. Perfect. See, I can see you in my phone now. Straight direction down. Bot CPR. Great. Very, very good. How you feel, David?
Good.
Excellent. Yeah, Yana doing good. She knows what she's doing. Do muscle spindle on him. There we go. Look at that. And if you guys want to order this beautiful massage therapist, talented massage therapist, the link below, and we'd be glad to help you work on your hips. Perfect. And again. Excellent. Yay. Next one, remember we don't have a lot of extension of the hip. Let me finish this one. I'll show you. And I see a lot of people, thank you. So I see a lot of people doing this wrong. What they doing? They try to stretch the quads and the hip flexors. They bring this leg, they hold it here, or they pull it on the knee, and all they do, they just start lifting this way. So when you lift this way, you dump that pelvis ilium down and also create a lot of tension in that lumbar spine. If someone have problems up there, you can truly do some damage. So what I'm usually do, if leg is short, if I possible to grab and put under my armpit, this is how I hold it. And the key is to find that SI joint, the sacrum and ilium, and lock it in. You see my arms, I turn and I lift it, I lock it in. So it's only work on that hips. It's not transferred to that lower back. And it's whatever you can go. You lift it up. You see, I'm leaning from side to side. I'm not lifting like you guys do, pull my shoulder towards my ear. All I do, I'm lean to this leg. And when I'm here, I'm just lock it in. The first barrier, ask him to push down. Push down, 1, 2, 3, 4, 5, and relax, and you can get some little bit more. Talk to your clients. You doing okay? Always ask. If any pain, you let me know. Now, you're a little bit kind of to the side. You see, I'm not just going kind of laterally and up. Again, next level. Push it down. Relax. And you can repeat position number 4. Bot CPR, you want to do this one? Quads?
Yeah.
Okay, sure. Come up. Yeah, other side, of course. We want him maximize as much as possible. Exactly. Bring it under your armpit. Perfect. Find that SI joint right here. Lock it in and start move only your body. Kind of lift it. Lean with your leg. Like lean. Here we go. Here we go. Look at that. Perfect. Arms straight. Everything straight. Look, very good postural. Excelente. Take to the first barrier. You kind of like lean a little bit towards, away from the table, like this direction. There we go. Perfect. Look at that. Is that good, David? Yes. Always communicate with your client.
And how far we go?
The usual it's a 15 degrees. You don't need to go. If sometimes some people, like I said, if you lock it in.
That's the stretch for the quad.
Yeah, quads, hip flexors is also mobilize that hip. If you're not gonna hold this arm, you can go too far, and like I said, you can put too much pressure on that lower back. We don't want that. And on your SI joint, you always have to lock that ilium and sacrum. Good. Okay. So this is probably about it. I also work on that QL muscle, just make that spasm away, activate the glutes, give them the homework. The homework is going to be bands, a lot of bands exercise. Go ahead, sit down. Sit down up here, lay your legs on the side. Get your, so we work on the right, okay. Get your ball up here, and I want you to do, I usually come up here, get that band, and ask him to pull towards the midline and away. Squeeze that ball. I'm trying to snatch that ball. Exactly what he's doing now, he's working on that hip mobility.
The same exercise might be used for adductor muscles, right?
Yeah, he's doing that. I can go from the other side. I can come in on this side too, doing the way. Exactly. Squeeze the ball. You see, I try to take it away. He's squeezing now.
When I squeeze it, I don't have very much internal work.
Exactly. But that's fine. It will take it time. Years I recovered that shoulder. Years. It's not gonna go away right away, but it's good now. Okay? That's what I'm looking for. Okay.
That's great.
Good.
Thank you.
Next one, we're gonna work on that shoulder. Yes. So let's memorize where we was and see how we can help. Okay. All right, David.
Okay, great. Thank you.
Get the hell out of here. Just kidding. Okay.